If you take a little pill every morning for your blood pressure, amlodipine, losartan, or lisinopril, how confident are you that you actually understand what it's doing inside your body versus what your body is doing on its own as you get older? Because here's the uncomfortable truth. Several of the most common things blamed on just getting old, swollen ankles, a nagging dry cough, leg cramps at night, are, for a meaningful number of people, not aging at all. They're your medication. Quick note first, this channel is for general education, not medical advice, and I'm not your doctor. Never stop, skip, or change your blood pressure medication on your own based on anything in this video. Always route any concern through your doctor or pharmacist. What I want to give you tonight is the ability to tell the difference between a nuisance side effect and something worth a real conversation at your next visit. Consider someone like Walter, a composite, not a real patient, 72 years old, been on lisinopril for years. His ankles started swelling a bit more each season, and he chalked it up to just standing too much. It wasn't standing, it was the medication working exactly as designed, just with a side effect nobody had connected the dots on for him. Here's what almost no one explains clearly. These three drugs are not the same kind of drug, even though they're often grouped together as blood pressure pills. Amlodipine is a calcium channel blocker. It works by relaxing blood vessels. Think of it like loosening a tightly clenched fist, letting blood flow through more easily. That relaxing effect is exactly what causes its most common side effect. Lisinopril is an ACE inhibitor. It blocks an enzyme involved in narrowing blood vessels. Different mechanism, different side effect fingerprint, especially when it comes to a certain kind of cough. Losartan is an ARB, an angiotensin receptor blocker. It works on a similar pathway to lisinopril, but at a different point in the chain, which is exactly why doctors often switch a patient from lisinopril to losartan when one particular side effect shows up. Same overall goal, lower blood pressure, three different mechanisms, three different patterns of what your body might tell you along the way. Swollen ankles and feet, amlodipine. Symptom/scenario, socks leaving deeper marks than they used to. Shoes fitting tighter by evening. Mechanism, amlodipine-induced peripheral edema is dose-dependent because amlodipine relaxes the small blood vessels in your legs more than the veins carrying blood back out. Fluid seeps into surrounding tissue. Analogy. Picture a garden hose with the intake widened but the drain left the same size. More flows in than comfortably flows back out, and it pools. Illustrative case. Walter's swelling from Act 1, steadily worse over months, never connected to his pill. Nuisance versus emergency line. Mild ankle swelling that's the same on both sides is usually a nuisance. Sudden one-sided leg swelling with pain or swelling paired with shortness of breath is not that needs same-day medical attention, since it can signal a blood clot or heart issue unrelated to the medication. Safe action. Adding a different class of blood pressure medication alongside amlodipine can reduce the incidence of this swelling. Worth asking your doctor whether that's an option, rather than assuming you have to live with it. The dry, nagging cough, lisinopril, symptom/scenario. A dry cough that won't quit, no cold, no congestion, just cough. Mechanism. This is a well-documented ACE inhibitor effect tied to a buildup of a substance called bradykinin in the airways, and lisinopril specifically has shown notably higher cough rates than losartan in head-to-head studies. Analogy. It's like a smoke detector that's become oversensitive. Nothing's actually wrong, but the alarm keeps tripping anyway. Evidence drop. In clinical studies, cough occurred in roughly 62 to 69% of the lisinopril groups studied, compared to about 17 to 29% for losartan, a substantial, well-established difference between these two drug classes. Illustrative case, someone like Dorothy, blaming a lingering cold for 8 months before mentioning it to her doctor. Nuisance versus emergency line. A persistent dry cough on its own is a nuisance, not an emergency. Coughing up blood, or a cough with chest pain or breathing difficulty needs prompt medical evaluation. Safe action. This cough typically resolves within about 4 days of stopping the medication, which is exactly why doctors often switch a patient from lisinopril to losartan rather than simply telling them to tolerate it. Never make that switch yourself. it has to be prescribed. Muscle cramps and leg pain, Losartan and Lisinopril. Symptom/scenario, middle of the night leg cramps that seem to come out of nowhere. Mechanism, Losartan may cause hyperkalemia, a high blood potassium level, and muscle cramps, often in the legs, are a symptom of this condition. Analogy: potassium is like the timing fluid in your muscle's electrical system. Too much or too little, and the contractions misfire, showing up as cramping. Evidence drop. Losartan's common side effects specifically include muscle cramps and leg or hip pain, and both Losartan and Lisinopril carry a real risk of elevated potassium, especially when combined with potassium supplements or salt substitutes. Nuisance versus emergency line. Occasional mild leg cramps are usually a nuisance. Numbness or tingling in the hands, feet, or lips, along with weakness or heaviness in the legs, can signal dangerously high potassium and needs prompt medical attention. Safe action. Ask your doctor before using any medicine, supplement, or salt substitute that contains potassium. This is one of the most overlooked interactions in this entire drug category, since many healthy salt substitutes are potassium-based. Dizziness and lightheadedness on standing, symptom/scenario. Standing up too fast and the room tilts for a second. Mechanism. All three drugs lower blood pressure by design. Amlodipine specifically can cause dizziness or lightheadedness, and this effect is often strongest right after standing, when blood pressure briefly dips before your body adjusts. Analogy: it's like a thermostat that's slightly overcorrecting. The system works, but the adjustment period is where you feel it. Evidence drop. This is among the most commonly reported side effects across all three medications in clinical trial data. Nuisance versus emergency line. Brief lightheadedness that resolves in seconds is a nuisance. Actual fainting or dizziness severe enough to cause a fall is not. Falls in seniors are a serious medical event on their own and should be reported to your doctor even if you feel fine afterward. Safe action. Stand up slowly, pause seated at the edge of the bed before rising, and mention any fainting episode to your doctor. Your dose may need adjusting. Fatigue and unusual tiredness. Symptom/scenario. Feeling drained in a way that doesn't match your activity level. Mechanism. Fatigue is among the most commonly reported amlodipine side effects and can occur with the other two as your body adjusts to lower blood pressure and altered blood flow. Analogy: think of it like a car's engine running at a slightly lower RPM. Everything still works, but there's less immediate power available for exertion. Nuisance versus emergency line. Mild, manageable tiredness is a nuisance. Fatigue severe enough to interfere with daily activities or paired with chest pain or irregular heartbeat needs medical attention. Safe action. Mention persistent fatigue at your next visit rather than assuming it's simply age. Sometimes it's a dose issue, sometimes it's genuinely unrelated, but it's worth ruling out. Cold, flu-like symptoms, and nasal congestion. Losartan. Symptom/scenario. A stuffy nose or sore throat that seems to linger without ever becoming a real cold. Mechanism. Losartan's common side effects include nasal congestion, upper respiratory infection symptoms, sinusitis, and sore throat. Analogy: the exact mechanism isn't as clearly mapped as the cough with ACE inhibitors, but it follows the same theme. The drug's effect on blood vessels extends to the small vessels in your nasal passages, not just the ones controlling blood pressure. Nuisance versus emergency line. Ordinary congestion is a nuisance. Difficulty breathing or swelling of the face, lips, tongue, or throat is a true emergency. This kind of swelling requires calling your doctor or emergency services immediately, regardless of which of these three medications you're on. Safe action. Persistent, unexplained congestion without an actual cold is worth mentioning, especially if it started around when you began the medication. Let's be completely clear on the two lines that matter most tonight. Ordinary nuisance side effects, mild swelling, an occasional cramp, brief dizziness, are things to mention at your next regular visit, not necessarily an emergency. But swelling of the face, lips, tongue, or throat, numbness and tingling with leg heaviness, fainting, or coughing up blood, those are not wait-and-see situations. Those mean calling your doctor today, or emergency services if breathing is affected. And the doctrine that applies to everything in this video: never stop or change your dose on your own because of a side effect. Suddenly stopping a blood pressure medication can be more dangerous than the side effect itself. The right move is always a conversation with your doctor about whether an adjustment or a switch makes sense. Here's the doctrine to leave with tonight. These three medications are not rescue medications, and their side effects are not automatically just aging. Amlodipine's calling card is swelling. Lisinopril's is the dry cough. Losartan swaps that cough risk for a slightly different profile, including muscle cramps tied to potassium. Knowing which drug does what lets you bring a specific, useful observation to your doctor instead of a vague, "I've just been feeling off lately." If this helped you connect a dot you'd been missing, type BP in the comments below. And if you want to understand exactly what your blood pressure numbers are actually telling you, and when one high reading matters versus when it doesn't, that's the next video. Watch that one next.